Types of depression. Major depressive disorder, MDD, is a serious and common mental health condition characterized by persistent feelings of sadness, hopelessness, and loss of interest in activities that were once enjoyed. It affects how a person thinks, feels, and handles daily activities, such as sleeping, eating, or working. Severe symptoms like low mood, feeling guilt, change in appetite, overeating or loss of appetite, disrupted sleep patterns, insomnia or excessive sleep, and noticeable changes in energy levels, fatigue or restlessness, lasting for at least 2 weeks. Persistent depressive disorder, PDD, dysthymia, formerly known as dysthymia, is a chronic form of depression that lasts for 2 years or longer. It is characterized by persistent feelings of sadness, low mood, or irritability, along with other symptoms that affect daily functioning. Symptoms are less severe than MDD but persist over a longer period. Bipolar disorder, formerly known as manic depression, involves cycles of mood changes that include periods of depression alternating with periods of elevated mood known as mania or hypomania. During manic episodes, individuals may feel euphoric, energetic, or irritable, with depressive episodes. Premenstrual dysphoric disorder, PMDD, is a severe form of premenstrual syndrome, PMS, that causes significant mood disturbances, including depression, irritability, and anxiety, in the days leading up to menstruation. Improve with the onset of menstruation and significantly interfere with daily activities and relationships. Seasonal affective disorder, SAD, is a type of depression that occurs seasonally, typically during the fall and winter months when there is less sunlight. Symptoms often improve during the spring and summer. It often includes low energy, oversleeping, weight gain, and a general feeling of sadness. Psychotic depression. This type of depression occurs when severe depression is accompanied by psychosis, such as hallucinations, seeing or hearing things that others do not, or delusions, strongly held false beliefs. Psychotic symptoms often revolve around themes of guilt, personal inadequacy, or nihilism. Individuals may also experience agitation, anxiety, or physical immobility. Peripartum, postpartum depression. Postpartum depression occurs in some women after giving birth. It includes feelings of extreme sadness, anxiety, and exhaustion that may make it difficult for them to complete daily care activities for themselves or for others. It can begin during pregnancy or up to a year after childbirth. Atypical depression is a subtype of MDD characterized by mood reactivity, meaning that a person's mood improves in response to positive events and increased appetite or weight gain, as well as excessive sleep, and a feeling of heaviness in the arms or legs. Disruptive mood dysregulation disorder, DMDD, is a relatively new diagnosis introduced in the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition. It causes severe temper outbursts and chronic irritability in children and adolescents. Situational depression, also known as adjustment disorder with depressed mood. Depression is typically short-term and occurs in response to specific stressors. One can have a depressed mood when one is having trouble managing a stressful event in life, such as a death in family, a divorce, or losing job, etc. Diagnosing depression involves a thorough evaluation by a healthcare professional, which may include medical and psychiatric history, gathering information about the person's medical history, including any past or current medical conditions, previous mental health diagnoses, and family history of mental health disorders, helps to understand potential contributing factors to the depression. Lab tests. Complete blood count, CBC. A CBC provides information about the number and type of blood cells and can detect conditions such as an anemia, which can contribute to symptoms of fatigue and low energy levels. Thyroid function tests, tests such as TSH, thyroid stimulating hormone, and free T4 levels help assess thyroid function. Abnormalities in thyroid function can affect mood and energy levels. Liver function tests. Liver function tests help assess liver health and detect any abnormalities that could affect metabolism and medication processing, which may impact mood. Kidney function tests. Kidney function tests, such as blood urea nitrogen, BUN, and creatinine levels, assess kidney health and ensure proper excretion of metabolic waste products. Electrolyte levels. Imbalances in electrolytes, such as sodium and potassium, can impact overall health and contribute to symptoms of fatigue and weakness. Blood glucose levels. Monitoring blood glucose levels helps rule out conditions such as diabetes or hypoglycemia, which can affect mood and energy levels. Treatment options. Treatment for depression often involves a combination of medications, antidepressants such as SSRIs, selective serotonin reuptake inhibitors, SNRIs, serotonin and norepinephrine reuptake inhibitors, or others depending on the individual's symptoms and response. Psychotherapy, talk therapy such as cognitive behavioral therapy, CBT, or interpersonal therapy, IPT, to help identify and change negative thought patterns and behaviors. Support groups. Participating in support groups or peer support programs can provide additional support and understanding. Lifestyle changes. Regular exercise, maintaining a healthy diet, ensuring adequate sleep, and avoiding alcohol and drugs can all contribute to managing symptoms. Electroconvulsive therapy, ECT, considered for severe depression that hasn't responded to other treatments, involves controlled electric currents to induce a brief seizure while the patient is under anesthesia. Thank you for watching my video. For more videos, kindly like, share and subscribe.